So as we wind this podcast up, tell me, what specifically are you going to do different than the other 5 members of the board if you do get elected? The other 4 members of the board if you do get elected? What are you specifically going to do different?
I think go and communicate with the physicians directly. I can be a resource to them to get their thoughts and points heard. I can provide better input and have better relationships. Being a physician myself, can understand where they're coming from. And in reality, that's kind of the starting point of recruitment and maintaining people in this community, as well as work with the nursing directors to try to understand what their concerns are, whether it be the mother-baby unit or the medical surgical unit. I think they're seeing difficulties across all facets, and they need to be recognized for their efforts during complicated times, and as well as the ones that did elect to stay as full-term employees, what we can do to kind of keep them in that capacity and not let them walk away to temporary staffing companies.
Absolutely. So are you running against an incumbent?
Yes.
Correct. So is there anybody else? Will there be a primary?
There is a primary currently. Ballots have been mailed out, and I would encourage everybody to go look at the ballots, vote. Your voice is important in all cases. There's been historically low turnouts in Grant County, and anything we can do to increase that, we're happy to. There's 3 people running. There's myself, Elliot DeLong, and Catherine Christian, who is the incumbent.
Okay. And so you and Elliot DeLong are in the primary?
All 3 of us are. The top 2 move on.
Oh, yeah, that makes sense. And then, I will tell you, speaking of every vote counts, when I ran over 20 years ago, I won by like 60-some votes, beat a 20-year incumbent, and made some major changes in the hospital. So every vote does count for sure. So go out and send in your mail-in ballots and vote for a doctor. Dr. Penix is well qualified. I think we need more physician staff physicians on hospital boards. They are obviously the most qualified person in the medical community. Unfortunately, they don't get treated like that. And I think it's about time that instead of hospital administrators running hospitals, I think physicians do. I think physicians should. And I will tell you that not that long ago, 25, 30 years ago, the doctors called the shots, not the hospital administrators. And the doctors still should call the shots. They need to take medicine back. Doctors are the most qualified people to run healthcare. They're the most educated. They should be running healthcare, not someone with an MBA, not some hospital administrator. We need to make sure that physicians are running healthcare. Vote for Dr. Brandon Penix. Brandon, how would you like to end the show?
Thank you, and I appreciate any vote. I will attempt to serve our community, and if anybody ever wants to get in touch, it's commissioner@nwmedicalgroupwa.com.